guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering reproductive issues and concerns. Guys, if you haven't done so already, please be sure to like and subscribe below. Make sure you press that red notification button so you'll know every time a new video is released. Without any further ado, guys, let's get started. First question. When assessing a patient for amenorrhea, the nurse should be aware that this is unlikely to be caused by A, anatomical abnormalities, B, type 1 diabetes mellitus, C, lack of exercise, or D, hysterectomy. And I'll give you a moment to think of your answer. All right, guys, and the correct answer is C, lack of exercise. Lack of exercise is not something that can cause a patient or put a patient at risk of amenorrhea, of not having their menstrual cycle. But the other choices, yes, they absolutely can stop a woman from her menses. Having anatomical abnormalities, being a diabetic, type 1, and of course, a hysterectomy. Obviously, if you don't have those reproductive organs, you're not going to have your menses. So A, B, and D absolutely can stop a patient from having their menses, which is amenorrhea, not having a menstrual cycle. But lack of exercise, which is C, is not one of them. Next question. Which symptom described by a patient is characteristic of premenstrual syndrome, PMS? A, I feel irritable and moody a week before my period is supposed to start. B, I have lower abdominal pain beginning the third day of my menstrual cycle. C, I have nausea and headaches after my period starts and they last 2 to 3 days. D, I have abdominal bloating and breast pain after a couple days of my period. And I'll give you a moment to think of your answer. And the correct answer is A, I feel irritable and moody a week before my period is supposed to start. And guys, I hope you saw there was something in common with B, C, and D, and A was the oddball out. What's the difference? A is the only one that has these symptoms before the onset of menses, before the patient starts having their menstrual cycle, their monthly cycle. Okay? PMS, premenstrual syndrome, that pre, that means before. So the patient has these symptoms before their cycle. So I want you to see something. Let's look at B, C, and D. The lower abdominal pain. That would have been PMS before their cycle. C, nausea and headaches before their cycle. D, abdominal bloating, so not so much pain, but tenderness before the cycle, right? That's what the PR in PMS is, premenstrual cycle. So that's why A is the correct answer. The patient has these signs and symptoms a couple of days before their period starts. B, C, and D, those symptoms are good, but the time frame that you're being given is wrong. And remember what I taught you guys. If one thing in an answer is wrong, the whole thing is wrong. Throw it out, okay? Let's move to our next question. When evaluating a patient whose primary complaint is amenorrhea, the nurse should be aware that lack of menses is often the result of A, stress, B, excessive exercise, C, pregnancy, or D, eating disorders. And I'll give you guys a moment to think of your answer. All right, guys, the correct answer is C, pregnancy. Now, let me tell you why this is tricky. Stress, excessive exercise, eating disorders, all of these are contributing factors. They actually can stop a woman from having her menstrual cycle. But let's go back to the question. Look what it says. It says that when you value primary, most often. That's your key. Most often. So even though, excessive exercise, think about those gymnasts or women who are very, very active in sports. They exercise so much and they become very thin that very often their menses can stop, right? That's a contributing factor. Stress can cause it. Eating disorders can cause it. But most often, when a woman, has regular cycles and all of a sudden it stops, what's the reason? Pregnancy. And see, most often that was the word that should have clued you into pregnancy and not anything else. Because like I said, A, B, and D are all possible. But what's most likely? the woman being pregnant. So that's why that is the correct answer. One of the alterations in cyclic bleeding that occurs between periods is called A, oligomenorrhea, B, menorrhagia, C, leiomyoma, or D, metrorrhagia. And I'll give you a moment to think of your answer. All right, guys, and the correct answer is D, metrorrhagia. That's bleeding between cycles. So if the person's not having their period right now, they're between periods, but they're still having bleeding, okay? So D's your correct answer. Now look at our other choices. You have A, oligomenorrhagia. Well, what does oligo mean? A little bit, just a tiny bit, scanty. So oligomenorrhagia is scanty menstruation, just a little bit, okay? B, menorrhagia, that's excessive, too much bleeding, too much menstruation. Then leiomyoma, and by the way, guys, that word, make sure that you can recognize it. What that means is fibroids. It's a fancy word for fibroids, but I've seen this many times on NCLEX, HESI, and ATI. They give you a situation and the patient has fibroids, but instead of saying fibroids, they use this word, leiomyoma, and that throws students off. All it means is fibroids, okay? So one more thing I want you guys to know about fibroids. Fibroids are not, they're not cancerous, okay? So they may make the woman uncomfortable. And if the patient has fibroids, if they're big enough, the patient may have fertility issues, but they are not cancerous. They're not deadly. They're not malignant. They will not kill the patient. And guys, I want you to please excuse me because I know I look crazy. I'm not even wearing my correct jacket. I'm sweating, but I just saw patients all day and I just got home. And if I did not make this video for you guys tonight to send to my editor, you guys would be out of a video in a couple weeks. So I chose just to make this video looking crazy and all. All right. Care management of a woman diagnosed with acute pelvic inflammatory disease, most likely A, oral antiviral therapy, B, bed rest in the semi-Fowler's position, C, antibiotic regimen continued until symptoms subside, or D, frequent pelvic examination to monitor the progress of healing. So I feel like I was missing something in that question, so I'm going to go back and read that question. Care management of a woman diagnosed with acute pelvic inflammatory disease most likely would be oral antiviral therapy, bed rest in the semi-Fowler's position, antibiotic regimen continued until symptoms subside, or D, frequent pelvic examinations to monitor the progress of healing. And I'll give you guys a moment to think of your answer. And the correct answer, guys, is semi-Fowler's position. Okay, you're going to have them on bed rest. You don't want them moving around. And guess what? With PID, which is extremely painful, they're not going to want to move around anyway. You're going to have that patient on bed rest and you're going to have them in the semi-Fowler's position. Let's look at our other choices. You have A, oral antiviral therapy. Well, PID 99.9% of the time is what? It's a bacterial infection. Okay. Patient has a bacterial infection because something introduced into the body that introduced the bacteria, and now they have an infection in their pelvic area. So why are we going to give them antivirals? That's not going to do anything for PID because PID is what? Bacterial. So that's not the answer. It's almost always bacterial, guys. C, antibiotic regimen. Okay, yeah, PID, the patient is going to get antibiotic regimen until symptoms subside. Excuse me? Where's my... I literally can't even. Don't you dare. You know patients take antibiotics. They take the whole full course, whether they feel better or not. You know that. Because if they don't and they just take the antibiotics until they start to feel better, what happens? Those antibiotics start to reproduce. They start to grow, and then it's a free-for-all, and then the infection gets even worse than before. And then when we try to give the patient antibiotics to kill that infection, no, the bacteria recognizes that medicine and it's now resistant. So patient does not take the antibiotics until they feel better. They take the full course, the whole treatment, whether they have symptoms or not. So we know that can't be the answer. And guys, I'm telling you, these test writers, that's how they'll try to trick you. They'll give you a right answer followed by a wrong answer. If the whole thing is not correct, the whole thing is wrong. Throw it out and choose the next best answer. So that's wrong. Choice D, frequent pelvic examinations to monitor the progress of healing. So let me get this right. Patient has an infection in their pelvic cavity, right? And most likely they got that infection because something was introduced into that area, right? Patient could have wore a tampon for too long, bacteria grows, now it's in the pelvic cavity. Patient could have had an IUD, bacteria, pelvic cavity, whatever it is. But most likely when patients have PID, it's from a foreign object, something foreign that introduces the bacteria. So why in the world would we do a pelvic exam where we could introduce more bacteria into that pelvic cavity? That makes no sense at all. Come on now. So that can't be right. We don't want to introduce more bacteria into that area. No. So what are you going to do? You're going to make sure the patient's in semi-phallus position, and that's the only right answer for these choices that you've been given. All right, next question. On vaginal exam of a 30-year-old woman, the nurse documents the following findings: profuse discharge with a fishy odor, complaint of pruritus. On the basis of these findings, the nurse suspects A, bacterial vaginosis, BV, B, candidiasis, C, I call it trick because I can't say the whole name, trichomoniasis, or D, gonorrhea. And I'll give you a moment to think of your answer. All right, guys, the correct answer is BV. You want to know what clued you into BV and you knew it was BV and not anything else? The fishy odor. The minute you see fishy odor, your mind needs to go to BV, all right? Let's look at our other choices. B, candidiasis. What's that? That's a fungal infection, right? What does it look like? The patient has whitish discharge, and that's described as cottage cheese. So just like when you see fishy odor, you're going to think of BV. When you see cottage cheese-like discharge, I want you to think of candidiasis. That yeast infection is a fungal infection, okay? Trichomoniasis, or trick as I call it, that one, yellow-green discharge, okay? And that's also smelly, has malodorous. Sometimes the patient's asymptomatic. They may not have any symptoms, but when they do have symptoms, really bad smell, malodorous, and you'll see a yellow-green discharge. That goes with trick. And then last, gonorrhea. That the patient will have purulent discharge. Sometimes the patient may be asymptomatic, but if they are symptomatic, the discharge that you'll see with that patient is going to be purulent, okay? All right, a 25-year-old woman comes to the gynecologist's office for a follow-up visit related to her abnormal pap smear. The test revealed the patient has HPV. The patient asks, "What is this?" Your best response: A, it's just a little lump on your cervix. We can freeze it off. B, HPV stands for human papillomavirus. It's sexually transmitted infection, STI, that can lead to cervical cancer. There's no known cure, but symptoms are treated. C, HPV is a type of HIV. You'll die from this. D, you probably caught this from your current boyfriend. He should get tested for this. Now, guys, I'm not even going to give you a moment to think of this answer because this should be a no-brainer. The correct answer is B. Even if you did not know what this was, you had no idea what HPV was, you should have said to yourself, I have to choose an answer that answers a question, right? So let's look at the wrong choices. A, it's just a lump on your cervix. We can freeze it out. Even if you didn't know what HPV was, does that sound like an appropriate answer to give a patient? It's just a lump and we can get rid of it? Are you really explaining to the patient what it is that they have? No, we're going to get rid of that. C, it's the type of HIV. Let's say we had no idea what HPV was and we're thinking, okay, maybe it is a type of HIV. Let's keep going. You'll die from this. What kind of explanation is that? Is that an appropriate explanation to give it to a patient? No. Get rid of that. Choice C. You probably got this from your boyfriend. You need to get tested from this. Is that an explanation telling them what it is? Even if you had no idea what HPV is? No. The only one that looks appropriate, even if you had no clue what HPV was, is B. It stands for human papillomavirus. It's sexually transmitted. It can lead to cervical cancer. There's no cure, but we can treat the symptoms. Okay? And that's absolutely true. And that's something very important for you to know about HPV. It can lead to cervical cancer. So the patient is found to have HPV. The next step, they're probably going to get I can never pronounce that word. Fundoscopy. They'll come to me. I'm saying it wrong. But it's a procedure where they will freeze it off. It starts with an F. It'll come to me. But anyhow, B is the correct answer. Look how much information the choice B gives you compared to all the other choices that you had here. All right, colposcopy. That's the word I was looking for. It didn't even start with an F. Colposcopy, yes. So if the patient found to have those HPV, they'll get a colposcopy, because what they were trying to prevent from happening is for those cells to develop into cervical cancer cells. Colposcopy. I could not think of that word to save my life. All right, next question. Which diagnostic test is used to confirm a suspected diagnosis of breast cancer? A, mammogram, B, ultrasound, C, needle aspiration, or D, CA 15.3. And I'll give you a moment to think of your answer. All right, guys, the correct answer is C, needle aspiration. And I've talked to you guys about this before, all right? The only way to 100% know for sure that this patient has cancer is not anything else. It's by doing a biopsy. Well, how are we going to get a biopsy of the tissue? Needle aspiration. Okay? So the minute you saw needle aspiration, your brain was supposed to go to biopsy. I'm doing that needle aspiration so that I can get a biopsy. Our other choices, mammogram, ultrasound. These are screening tools. If the mammogram's positive, the ultrasound's positive, those are screening tools to let you know that, we need to do further investigation. We're probably going to need a biopsy. They are not diagnostic tests. They're screening tests, okay? Remember, I talked to you guys about this. You have primary, secondary, and tertiary prevention. Primary prevention is your teaching, your vaccination. Secondary prevention is your screening, such as an ultrasound, such as a mammography, such as a colonoscopy, right? Tertiary is when the patients already have it and we're trying to prevent it from getting worse, something like rehab, all right? So A and B, those are screening tools, secondary form of prevention. And then you have your CA 15.3. That's a test. It actually gives you tumor markers. So after a patient has gone through radiation, they've gone through chemo, you can do the CA 15.3, and that tells you if there are any cancer cells left, right? So that's something that's going to be done after the patient gets treatment for us to see if there's any cancer that's still in the patient's body. All right. After a mastectomy, a woman should be instructed to perform all of the following except A, emptying surgical drains twice a day as needed. B, avoiding lifting more than 4.5 kilograms or reaching above her head until permission is given by her surgeon. C, wearing clothing with snug sleeves to support the tissue of the arm on the operative side. Or D, reporting immediately if inflammation develops at the incision site or in the affected arm. And I just said a mouthful, so I'll give you guys a moment to think of your answer. All right, guys, so the correct answer is C, wearing clothing with snug sleeves to support the tissue of the arm on the operative site. This question's asking us, what's the wrong one? Which is the one we are not going to tell the patient to do, right? So let's talk about our right choices. A, We want the patient to empty surgical drains twice a day and as needed. Why? We want to decrease the edema formation, so we want that fluid to drain. So that's good. We want them to do that. Choice B, avoid lifting more than 4.5 kilograms or reaching above the head. Why? We don't want anything that will increase pressure or decrease circulation. So absolutely, that is very, very true. Choice D, report immediately if inflammation develops at the incision site or affected arm. Absolutely. Redness, excessive or persistent pain, foul odor, purulent drainage, anything with signs and symptoms of infection, we want the patient to report immediately, because we know post-op, it doesn't matter what kind of surgery patient had, whether it was an operation, they had a mastectomy, they had a portion of the colon removed, whatever it is, we're concerned about what? Infection, hemorrhage, bleeding, and of course DVT and pulmonary embolism. So D is correct as well. But what we don't want them to do is C. We don't want, you see that word snug? That means, tightly, right? We don't want anything compressing that area. Nothing at all. We don't want anything that will mess with the surgical site. We don't want anything that will decrease circulation. That's why on the arm that the patient had the mastectomy, we don't do blood pressures. We don't do venipunctures. We don't do anything. We don't want anything to mess with that surgical site. And remember how close the lymph nodes are to that breast tissue. So we don't want to mess with that area at all. So C is absolutely incorrect. We don't want anything tight, anything that will compress that surgical site. What important immediate post-op practice? Excuse me, guys, I'm sorry. I've been working all day and I'm exhausted. I can hardly even see. Forgive me. What important immediate post-op care practice should the nurse remember when caring for a woman post-mastectomy? A, blood pressure cuff should not be applied to the affected arm. B, venipuncture for blood work should be performed on the affected arm. C, the affected arm should be used for IV therapy. Or D, the affected arm should be held down close to the woman's side. And in my explanation for the last question, I didn't even know, but I gave you that, guys, the answer already. So you know what the answer is. The answer is A. The blood pressure cuff should not be applied to the affected arm. We don't want anything squeezing that area. We don't want anything messing with that surgical site. We don't want anything that can possibly decrease circulation or decrease the drainage, because remember, we want that fluid to drain, right? So A is the correct answer. Choices B, C, and D are big no-nos. We are not going to do that. We're not going to do any IV on that arm. We're not going to get blood from that arm. We're not going to take blood pressure from that arm. We're not going to have that arm down to the side. We want it. Why? We want that drainage. Okay? So B, C, and D, wrong, wrong, wrong. We want that arm elevated. We want all of that fluid to drain. We want to decrease that edema. Oh, I'm so happy I made it, guys. We're down to our last question. The nurse is providing care in a women's health care setting. I'm sorry, I have to start over. The nurse providing care in a women's healthcare setting must be aware regarding which sexually transmitted infection can be successfully treated and cured. A, herpes. B, AIDS. C, venereal warts. Or D, chlamydia. And I'll give you guys a second to think of your answer. All right, guys, and the correct answer is D, chlamydia. Did you guys notice something? Choice A, B, and C are all what? Viruses. They're all viral. Do we have cures for viruses? No, right? We may have antiretroviral to help bring those virus numbers down, but we have no cures for viruses. That's why they're what? Viruses. So herpes, that is a viral infection. There is no cure for herpes. AIDS, that is a viral infection. There is no cure for AIDS. C, venereal warts, that is a viral infection. There is no cure. But chlamydia, that is a bacterial infection. The patient can get azithromycin or doxycycline. Those are antibiotics. Cure, right? But the first three, A, B, and C, all of these are viral and viral infections, and there are no cures. Guys, I hope this video was helpful, and I'd love to hear from you in the comments. Let me know what you think about this video, and please be honest with me because I really want to know how you feel. Let me know. Professor D, if you've been seeing patients all day and you're exhausted, please do not ever make a video again because it was a waste of my time. Or if it was worth it, it was still helpful, let me know because it'll actually help me decide on when I should make the videos or not. I didn't want you guys to go without a video on one of the upcoming weeks, so I just pushed myself. But if you got nothing out of it and you rather just wait the next week to get a better video, let me know. I really want to hear from you guys in the comments. Thank you so much for spending the time with me, and I'll see you guys on the next video.